Hi, everybody. This is Dr. Brett Talley Daniel, MD, a neurologist and headache doctor, making a podcast on the subject of what are helpful rules for acute migraine treatment. Migraine is present in 12% of the world's population and in 25% of women and 6% of men. It's a severe, disabling medical condition that often leads to evaluation in the emergency room. What are the helpful rules for acute migraine treatments? Here they are. Treat at onset, take the right drug, and take enough of the right drug. So treat at onset. This means that all medication should be taken at the very first beginning of the headache. Don't wait thinking it's not going to be one of those when it very well may be one of those, which is a bad headache coming on. Migraine headaches may start in the back of the head and move forward behind an eye. Treat it while it's in the neck. Migraine without aura headaches may also start in the forehead, eye, or cheek area. This is not sinus headache, unless there's a green or yellow nasal discharge or pus on a CAT scan of the sinuses. Treated as a migraine. Sinus headache, the phrase, is not in the International Classification of Headache. All the generic triptans except naratriptan and frovatriptan work in 30 minutes and should be used, and these are Imitrex, generic sumatriptan, Zomig, generic zolmitriptan, Maxalt, also called rizatriptan, Relpax, which is elatriptan, or Axert, which is almotriptan. Frova, which is frovatriptan, and Emerge, generitriptan, take 1 to 2 hours to work and are mainly used nowadays for menstrual migraine. 80% of migraine patients may be pain-free at 2 hours if they treat at onset. Triptans block the release of neurochemical inflammatory drugs which come at 20 to 40 minutes into a migraine. Triptans are the universal best drugs for acute therapy for migraine. However, 20% of patients don't respond to triptans, and other treatment options must be pursued. Take the right drug. In general, for severe migraine patients, this is going to be a triptan. It's true that many patients with mild migraine can treat their headaches with Excedrin or an NSAID like ibuprofen and naproxen, but for the severe headache patients, the type that end up in the doctor's office or in the emergency room, they will need usually a triptan. Usually, the triptans will treat the whole migraine syndrome: headache, nausea, vomiting, photophobia, sonophobia, and they work best if taken at onset. The next rule and last rule is take enough of the right drug. This is a dosing situation which varies from patient to patient. As a joke, elephant rifle load, that's the biggest gun there is, for migraine remains injectable Imitrex sumatriptan 6 milligrams subcutaneously, which works the fastest in 10 minutes and gives the highest blood levels. So we've got here also oral Imitrex, Trexamet, which is a combo drug of sumatriptan and naproxen, Maxalt, Zomig, Axert, Relpac, Emerge, and Frova. So it is a short dictation today on the subject of what are helpful rules for acute migraine treatment. Please click subscribe down there so we can follow each other, and look for me on Podbean and Spotify for other podcasts on migraine. Feel free to go to my migraine blog at www.drmigraine.com, and I will see you on the next talk.